lecture will be divided basically into the anatomy, the gross anatomy of the perineum itself, okay, how it is divided into the anal and urogenital triangle, and then what will be the contents of each of the triangles in the perineum. Then we will go into the male external genitalia, and of course we will discuss first the anal canal before we go into the male external genitalia. Okay. So where do we find the perineum? It's basically the region of the body that is found in between the thigh. Okay. So if you separate the thigh, okay, in the near its origin, okay, you will see the perineum. Okay. Now the perineum is a region of the body that's not frequently visited, by physicians. Well, unless you are an obstetrician or a colorectal surgeon or maybe a urologist, okay, you don't frequent the area of the perineum. Okay. It is a shallow compartment of the body bounded by the pelvic outlet, separated from the pelvic cavity by the fascia. I'm sorry, by the fascia that is covering the interior aspect of the diaphragm. What diaphragm is this? The pelvic diaphragm. Okay. So yung pelvic diaphragm that we discussed in our lecture in the pelvic cavity is covered by two layers of fascia, okay, yung superior and inferior. No? The inferior layer or your parietal layer of pelvic fascia. Okay? And this inferior layer of parietal layer of pelvic fascia, okay, covers the undersurface of the diaphragm. Okay? And this would basically serve, okay, as a demarcating line, okay, of the perineum below. So everything below the diaphragm and the fascia that covers it is already the perineum. All right. So it would be okay. So this would be the area of the perineum in the male, and this is a drawing that is superimposed, no, upon the male perineum. Okay. You can see here the superficial muscles, okay, the anus and the anal sphincters that are found in the area of the male perineum. Okay. Now, in between, if we look at the perineum, it will be likened to a diamond-shaped, okay, area. Okay, a diamond-shaped area. Okay, if you draw an imaginary line along the border of what we call the perineum, okay, it's about diamond-shaped. The the anterior, mid-anterior, okay, you have your symphysis pubis, and exactly at the opposite, posterior, mid-posterior, at the tip of the coccyx. And if you go lateral, you have the ischipubic rami, and inferolateral, you have the sacrotuberous ligament. Okay, now this would now be the boundary of what we will call the perineum. Now, if you draw an imaginary line connecting the two ischial tuberosities, no, from left to right, you will bisect or you will divide this diamond-shaped area into two triangular areas. One half of it on the anterior, the other half on the posterior. Now, the anterior triangle is known as the urogenital triangle, while the posterior triangle will be the anal triangle. Now, each of the two triangles will contain different structures, okay? And likely, understandably so, that it will be also covered by different layers of fascia, okay? Now, first we discuss what is the perineal body or the central tendon, shall we say, of the perineum. It is a fibromuscular structure that we find anterior to the anus, but posterior to the bulb of the penis. Now, it's an important structure because it serves as attachment for perineal muscles and it serves to strengthen the perineum. Okay? Yeah. Point of stability of the perineal of the perineal integrity, okay? Yung central tendon, okay? Or the perineal mass. Okay? Now, also in this view, you see already the superficial muscles in the urogenital triangle and the external inner sphincter in the anal triangle. Okay, we'll go first to the anal triangle. So it is the posterior half of this diamond-shaped perineum, okay, bounded by your ischial tuberosity, sacrotuberous ligament, and the tip of the coccyx. Okay. Now the anus, okay, will lie at exactly the midline. Okay, okay. It's exactly at the midline, okay? And on both sides of the anal canal are two spaces. This would be your ischiorectal or ischioanal space. And ischioanal fossa or space lies on each side of the anus or the anal canal. So let's start with discussing the anal canal. What is the anal canal? It's a 4 centimeter long terminal end of the alimentary tract. Okay? And the anus is the opening. Okay? So the anus is the opening, and the tunnel, shall we say, or the canal that goes in from the opening is the inner canal. It's about 4 centimeter long, and it is the configuration is roughly passing downward and back, okay, from the rectum. From the rectal ampulla, it will pass down and back in direction. Okay? And it has the following relations. No? Anteriorly, it is related to the central tendon or the perineal body, the urogenital diaphragm, the membranous urethra, and the bulb of the penis. Laterally, of course, the two spaces we call the ischiorectal or ischioanal space. And posteriorly, the anococcygeal body. Now, if we compare if we look at the anal canal itself, no, it is divided into two halves, no, an upper and a lower half. Okay. Now, why do we divide it into this half? Because the two halves of the anal canal is derived from two different embryonic origin. The upper half comes from endoderm, while the lower half comes from ectoderm. Okay. Ectodermal derivative of the protozoa. That's why the lining epithelium is different. The lower is lined by stratified squamous, while the upper by columnar epithelium. In the upper half, you see vertical folds, okay, in the anal canal, known as your anal columns, okay, while you do not see anal columns in the lower half. The innervation of the lower half is more somatic, okay, because it is innervated by the inferior rectal branch of the pudendal nerve. That's why the lower half of the anus or the anal canal, sorry, the anal canal, is sensitive to general sensation, meaning pain, touch, pressure, temperature, while the upper half is innervated by autonomic bilateral hypogastric plexus. So it's basically sensitive to stretch, but not to other sensory impulses. You know? Thus, also the blood supply will be different. Okay, if the upper half is supplied by your superior rectal artery, the lower half, okay, will be supplied by your inferior rectal. Okay, that is derived from your internal pudendal artery. Okay. Venous drainage will also be different. The upper half goes upward into the superior rectal and eventually draining into the inferior mesenteric vein, while the lower half will go sideways. Okay? So, towards the internal pudendal vein, eventually ending up in the internal iliac. Now, the lymphatics, okay, the upper half goes upward towards the pararectal nodes, while the lower half of the anal canal goes to the medial group of the superficial inguinal lymph nodes. You see here, um, if you have a pathology or a lesion involving, therefore, the anal canal, the lower half of the anal canal, you can have enlarged lymph nodes in the inguinal region. So if you have enlarged lymph nodes in the inguinal region, don't only look at the lower extremity. No? For lesions in the lower extremity, also look at the anal canal, because the lesion might be there, and that's the reason why you have inguinal the lymphadenopathies in your patient. Now, this is a picture of the sphincter. These are your external inner sphincters. It is made up of three components. Okay, I'm just talking about the external. Okay, made up of three components: your subcutaneous, your superficial, and your deep. Okay. Your subcutaneous component and your deep component and the external inner sphincters are true sphincters because they are what you call this round shape, rounded or ring shape, and they have no bony attachment. They have absolutely no bony or ligamentous attachment. Okay? Talagang paikot lang silang ganyan. Unlike your superficial component of the external inner sphincter, which is attached anteriorly to the perineal body and posteriorly to the anococcygeal body. Okay. Now, the external inner sphincter is under voluntary control. Remember, if your rectum is filled with fecal material and you cannot dispose of it, okay, you cannot readily defecate, you contract your external inner sphincter, so you prevent any further descent on the contents of the rectum into the anus canal. Okay, also in this picture, I would like you to look at this fiber of muscle. This is the puborectalis muscle. Where did you encounter the puborectalis in your lecture? Where did you encounter the puborectalis muscle? It's part of the levator ani muscle. It is the muscle fiber of your levator ani that is closest to the rectum. Yes. Notice that it forms a sling-like, okay? Sling-like structure around the rectum at the distal end. Yung pinakadulo na ng rectum at yung beginning ng anal canal. That is where you find the puborectalis. And the pull, okay, imagine this muscle as pulling the rectum forward this way so that there is now an angulation. So hindi diretso na ganyan, naka-angulate yung rectum mo in anal canal. And this adds to the continence. So hindi lahat, not the contents of the rectum will not readily go down into the anal canal, you know, because of the contraction of the puborectalis muscle part of the levator ani muscle. Okay, so it adds to the continence or the control of that. Okay, now this is the coronal section of the anal canal. So this will be the lower half of the anal canal. This will be the upper half. Now, the demarcating line between anal canal and the rectum is what you call the anorectal ring. Okay? Anorectal ring is something that you can palpate, and it's basically the uppermost border of the sphincter. Okay, it's the anal sphincter, and from that point going upward, this will now be the rectum. Now, the demarcation between upper and lower halves of the anal canal will be basically this sawtooth configuration of your pectinate line, okay, or your dentate line in other books. Okay, yeah. So this will be upper half. This will be the lower half of your anal canal. Okay. The sphincters I mentioned, which I showed in the diagrammatic fashion, will be this one, between subcutaneous, between superficial, between your sphincter. This is a coronal section of the sphincters. And there's another sphincter that surrounds the anal canal. That is the internal anal sphincter. You know? The internal anal sphincter is made up of the circular layer of smooth muscle from your anus. Okay? Remember, your alimentary tract is made up of two layers of smooth muscles, right? An outer longitudinal and an inner circular. Okay, so the inner circular fibers will be the one forming the internal inner sphincter, and thus this is involuntary. Okay, involuntary. It will relax if there is fecal material that will descend into the anal canal. Okay, but what you will contract to control for continence is the external inner sphincter. Now, in between the external and internal inner sphincter is this layer of what we call the intersphincteric line, okay, or space, okay, that is basically occupied by the longitudinal layer of your smooth muscle. Okay, longitudinal, the inner circular, outer longitudinal, descends downward into the space found between the two sphincters, external and internal sphincter. So I mentioned already the comparison between upper and lower anal canal, the venous drainage, the lymphatics. Okay, not go into that again. So let's go into this space now, the two spaces found on each side of the anal canal, and that is the ischiorectal fossa. I partly mentioned the ischiorectal fossa during my lecture in the pelvic cavity. Okay. Why? Because the ischiorectal fossa is found on each side of the anal canal, exactly below the level of the pelvic diaphragm. Although it is below the level of the pelvic diaphragm, though, one of the muscles that is found in the pelvic cavity, specifically the obturator internus, okay, will continue down into the perineum to form the side wall of the ischiorectal fossa. Okay. I mentioned the obturator internus during my lecture in the pelvic cavity, which you find in the lateral side of your pelvic cavity. So the same muscle continues downward into the perineum to form the side wall of your ischiorectal fossa. Okay. So the side wall of the ischiorectal fossa, so if you go laterally, you have the obturator internus, specifically the lower part of the obturator internus. And the same fascia that covers the obturator internus above, okay, in the pelvic cavity, is the same obturator internus fascia that will cover this muscle when it is already in the perineum. Okay, so may obturator internus fascia pa rin dito sa perineum. Okay. Okay, and that will also be part of the lateral wall. On the medial wall, of course, is this muscle. It's already part of the iliacal muscle, the pelvic diaphragm. Okay, the upper edge, of course, yan yung pyramidal shape. Remember, yung pinaka-tip, no, is the junction between the medial and your lateral wall. Okay, and of course, the inferior part of this triangular pyramidal shape, is the skin inside the veins. Now, what is found inside the ischiorectal fossa? Okay. Of course, it contains a lot of fat. Dense layer of fat is found in the ischiorectal fossa. So, puro taba lang pala ang laman yan. Bakit may mga taba dyan? Okay. So that it will allow the rectum to distend outward into the ischiorectal fossa. Kaya meron yung fat in that space. So you allow the rectum to distend kung meron yung content into the ischiorectal fossa. But aside from the fat, you also have nerves and blood vessels, specifically your pudendal nerve and your internal pudendal artery and vein. The three structures are found here in this canal called the pudendal canal, or the Alcock's canal is another name for the pudendal canal. And it is formed when the blood vessel, when the pudendal nerve and vessel goes underneath the fascia of the obturator internus. When the blood vessel and the nerve insinuates itself underneath the fascia of the obturator internus, it will form a canal. At the lateral, remember, a coronal section to it's a coronal section of the rectum and the anus, no, and the perineum. Okay. Also, you will find that the inferior rectal branch of your internal pudendal artery will cross, parang horizontal, to reach the anal canal this way. Horizontal. So, point of origin to reach the rectum, the anal canal, it will have to come across the nerve and the blood vessel will have to cross the fossa to reach the anal canal. Okay. Now, part of the structure that we find in the Alcock's canal is the pudendal nerve. Now, this is a very important nerve when it comes to the perineum because it is the chief innervation of the perineal region, both sensory and motor. So the muscle in the perineum is basically innervated by the pudendal nerve. Now, the pudendal nerve is derived from the sacral plexus, specifically from S2 up to S4. Okay, and it leaves the cavity via or through the sciatic foramen. Okay, through the greater sciatic foramen. Once it leaves the greater sciatic foramen, okay, via the greater sciatic foramen from the pelvic cavity, it will enter shortly the gluteal region, and then it will double back to enter the lesser sciatic foramen. When it does so, it will now be in the perineal region. So pag nag-double back siyang gano'n, nasa perineum na siya. When it enters the left sciatic foramen. And notice that it goes to the side. Pumupunta po siya sa gilid, okay? And it will insinuate itself underneath the obturator internal fascia to form this canal or tunnel called the pudendal canal. Yeah. And once it emerges from the pudendal canal, it will move off its branches. Okay? Ito pa lang para dito, before it even enters the canal, it will already be off the inferior rectal nerve, okay? Which innervates the lower half of your inner canal. Okay? Also partly the rectum. Okay? Now, the other branches of the pudendal nerve in the male will be, of course, this one, the dorsal nerve to the penis, and you have your perineal branches, okay? And you have the posterior scrotal nerve to innervate the posterior half of the scrotum. We'll discuss the scrotum later. Okay, all right. Okay. The pudendal nerve is also the nerve supply to the external anal sphincters, to the muscle found in the perineum. Okay, and yung mga muscle niyo, scarobernosus, bulbus spongios, etc. Okay. And these will be the branches. Okay. Now, accompanying the pudendal nerve is, of course, the internal pudendal artery. And we know that the internal pudendal artery is a branch of the anterior division of the internal iliac artery. And it goes, its direction is the same as that of the pudendal nerve. Its direction is also the same as the pudendal nerve, okay? And that its branch, okay? Branch travels together with the pudendal nerve and almost the same branches as that of the nerve. Okay, almost the same branches as that of the nerve. Continue. Continue. So you have the pudendal artery and the pudendal vein. Now the internal pudendal vein drains eventually to the internal pudendal we call the internal iliac vein, no? Okay. And eventual drainage ng internal pudendal vein, okay? Internal iliac vein. Okay. Now we go to the urogenital triangle. Okay, we finish with the anal triangle. Now we go to the urogenital triangle and its contents. So it's the anterior half of the perineum, okay, this time bounded by the pubic arch on each side. Okay, of course the simplest pubis at the middle, and of course this imaginary line here, okay, in the posterior. Now we will discuss the urogenital triangle first by layers, before we discuss the content of the urogenital triangle. We will discuss first the covering, shall we say, of the urogenital triangle. Okay, from outside going in, okay, it is covered by skin, superficial perineal fascia, then deep perineal fascia. Then between superficial and deep perineal fascia, you have your superficial perineal space or pouch, okay, and your deep perineal space. Okay. So we'll start with the superficial perineal fascia. Now, if you will recall, in the abdominal wall, you have your subcutaneous layer. Okay, and that subcutaneous layer in the abdominal wall is divisible into campers, which has more fat in it. Okay, the campers fascia, and the more membranous layer, your scarpas. Okay, the campers and scarpas layer of your abdominal wall, okay, will also descend down into the perineum and form covering over the external genitalia and over the perineum itself. Okay. So it will sweep down or sweep down into the perineum to cover the external genitalia as well as the urogenital triangle. Okay. Kaya nga yung fat, no? The fat that's supposed to be contained in the transverse fascia will also go down into the perineum. But when it reaches the level of the scrotum, the fat will basically be converted into muscle. Okay? That's why the transverse layer of the fascia will become now the darkest muscle in the perineum. Okay? But the other layer, okay, the one that contains less fat, the deep membranous layer of the superficial fascia, will become your polys fascia. It continues anteriorly with the scarpas fascia and the anterior abdominal wall, okay, and it forms a tubular sheath. Forms a tubular sheath, okay, continues with the superficial fascia of the penis. So it continues over the penis to form a tubular sheath around it. Ito, yung membranous layer or polys fascia of the perineum. Now let's discuss about the spaces. The spaces in the perineum is also called pouches. Meron pang superficial perineal space or superficial perineal pouch. Meron pa din deep perineal pouch. Okay. So what will demarcate one from the other? First, we go to the superficial perineal pouch. It is the zone between superficial perineal fascia and the perineal membrane. Okay. Ito yung superficial perineal fascia natin, the one in blue. Ito yung half of the superficial perineal fascia. Ito yung deep perineal fascia, the one in green, green line. Now, deeper to this, the deep layer of superficial fascia, or deep layer of the perineal fascia, is this red line here. Red line na yan, that is the perineal membrane. The perineal membrane is the all-important demarcating layer, okay, between superficial perineal pouch and the deep perineal pouch here. Okay. So, just discussing, just wanted to see the two spaces first. So, yung superficial perineal pouch is this space here between the blue line and the green line here. So, ito yung superficial perineal pouch. The deep perineal pouch is just this thin space here. Okay. Hindi na kasama itong sa taas. Ito lang. The one with the pink color. Okay, that's the deep perineal pouch. Okay. At mas maliit yung space na yan, yung pouch yan, as you would compare it to the superficial. Okay. Okay. Now let's discuss about the superficial pouch. Okay. Anteriorly, this space communicates with a potential space in the anterior abdominal wall. So, in the anterior abdominal wall, meron na continuation itong superficial perineal pouch. But, potential space lang siya. Meaning, hindi siya bukas. Hindi open yung space na yan. It's just a potential space. So, just in case you have an accumulation of fluid here in this superficial perineal pouch, like, say, blood or maybe urine. Remember, because the corpus spongiosum is there, okay, but escape into the superficial perineal pouch, it can actually ascend into the abdominal wall, okay, into that potential space. Now, if we follow the layer that is comprising or enclosing the superficial perineal pouch, okay, you will find that it is attached, to the margin of the pubic arch, pubic bone. Okay. It is attached to the margin, yes. Superficial layer to yung deep layer, perineal fascia mo, is attached to the pubic arch, okay? And it is there that it is closed. Okay? It is closed by the attachment of the membranous layer of the superficial fascia and perineal membrane to the margin of the pubic arch. So yung deep layer also will blend with that of the perineal membrane to close off this space. Posteriorly, okay, it is closed by the fusion of its wall with the perineal membrane and the perineal body. So, yung superficial perineal pouch po, okay, is found only in the urogenital triangle. Okay? It actually does not continue into the anal triangle. Why? Because it is closed. So, yung fascia that is lining or enclosing the superficial perineal pouch, okay, is closed by the fusion of its wall with the perineal membrane and the perineal body sa likod. So, hindi na po siya nagpo-continue. Ito, the one in white, yan. Yan, yan yung perineal fascia. Ito. Notice that pagdating dito po, okay, hanggang dyan na lang po yung perineal fascia mo. It does not continue here in the anal triangle. Ito, dito. So, nag-fuse na siya dyan. So that your superficial perineal fascia ay nandito lang po. Okay? Wala po dito. Ito lang po ang superficial perineal fascia. Okay? And that white structure there is what we call this, the deep layer of your perineal fascia. So if you open that, doon mo pala makikita yung perineal membrane that will separate the deep from the superficial perineal pouch. And incidentally, okay, all of this structure that we see here, kasi binuksan natin yung kulay puti, since we open already the deep layer of your perineal fascia, we are now able to see the contents of the superficial perineal pouch. What is contained in the superficial perineal pouch? The bulb of the penis, or in the female, the bulb of the testicle, which is basically plus the bulbous spongiosus muscle. Yeah. Also, we find the crura, or the root of the ischiocavernosus. What was ischiocavernosus? Okay, and which is continuous with the corpora cavernosum and the body of the penis. Okay. We also see the superficial transverse perineum. So bulb of the penis, the crura, okay, of your ischiocavernosus. Okay. Okay. Superficial transverse perineum. Okay. All of this we see in the superficial pouch of the male. Okay. Now notice that in the superficial perineal pouch of the male, you do not see any gland there. Walang gland po dito sa superficial perineal pouch of the male. Unlike in the female, okay? In the female, sa superficial perineal pouch pala, makikita mo na to, greater vestibular gland in the female. But notice that in the male, wala kang gland na makikita in the superficial perineal pouch. Okay? Now, incidentally, the embryonic counterpart of the vestibular gland in the male is the Cooper's gland, or the bulbourethral gland, but we do not find it here in the superficial pouch. We find it in the male. Okay. Oh, by the way, in your manual, I think the Cooper's gland is spelled Cooper's gland. Check na lang. Should be spelled Cooper, C-O-W-E-R, Cooper's apostrophe. Okay? Alright. Okay. So ito yung mga muscle that I mentioned, superficial transverse perineal. Okay. The bulbous spongiosus muscle is the one that covers the erectile tissue. Okay. So sa ilalim po nitong muscle na ito, bulbous spongiosus muscle, is the corpora spongiosa and the bulb of the penis. Okay. And your ischiocavernosus muscle is the one that covers the root of the ischiocavernosus. Okay. Corpora, the one that covers the root of the corpora cavernosa. Okay. The ischiocavernosus is a muscle that is covering the root of the corpora cavernosa. Okay. Now, what about the deep perineal pouch? So, when you penetrate or when you open the perineal membrane, you will now enter the very narrow deep perineal pouch. Okay. Deep perineal pouch is the zone located deep, okay, deep to the superficial perineal space. The perineal membrane forms the inferior boundary of the pouch. The inferior fascia of the pelvic diaphragm forms the superior boundary. Okay. So ito yung deep perineal pouch. Okay. Now, the muscle in the deep perineal pouch is basically this one, deep transverse perineal muscle, and the sphincter urethrae, and of course, yung all-important bulbourethral gland. Yun ang content ng deep perineal space. So, okay. The external urethral sphincter, okay. The deep transverse perineal muscle, the nerve, okay, and blood vessel, okay, to the external genitalia, the anterior recess to the sphenoidal fossa. Okay. So ito yung urethra, of course, since nandun yung sphincter, okay, nandun din yung part ng urethra that passes through it. Okay. So, yeah. This is already the deep perineal pouch. Notice na wala ka na diyang cavernosus, wala ka na diyang bulbus spongiosus, wala ka na diyang bulb of the penis, wala ka ng corpora cavernosa. This is already the deep pouch. This is the deep transverse perineal. This is the sphincter urethra. This is the urethra. Okay. These are the blood vessels in the deep perineal pouch. And this is the gland that I mentioned, the Cooper's gland, or otherwise known as the bulbourethral gland. Okay. Though the gland is found in the deep perineal pouch, no, yung duct niya opens in the bulb of the penis. And remember that the bulb of the penis is found in the superficial pouch. Okay. Now, let's go to the external genitalia of the male. Okay. Now, first is the penis. Okay. So the penis is the male organ of copulation. Okay. It has a fixed root, okay, but the body and the tip is pendulous or hangs loosely. Okay. The root of the penis, okay, is where we find the bulb of the penis, and we also find the root or the flora of the corpora cavernosum structure. Okay. If we follow the content or what is inside the bulbus spongiosus, okay, we'll find the bulb of the penis. We will find the corpora spongiosa. Okay. This one is the corpora cavernosa. Okay. Remember, these two groups of structure, these are your erectile tissue. So, these are not made up of muscle, they are erectile tissues. The corpora spongiosum and corpora cavernosa, okay, are erectile tissue. Now, the bulb of the penis is the slightly dilated proximal end of the corpus spongiosus. Okay, the dilated distal end of the corpus spongiosus is the glans penis. Okay? Ito yung distal, ito yung proximal. Ito yung glans penis, ito yung bulb of the penis. Okay, magkaiba po. Belonging to the same corpora but on both ends. Now, what traverses the corpus spongiosus is the penile urethra. Penile urethra that courses through that. Okay. Okay. Now, the bulbus spongiosus muscle is what covers the corpora spongiosa, and what covers the flora or the root of the corpora cavernosa is your ischia cavernosus. Okay. Continues forward into the body of the penis to form the corpus spongiosus. Okay. Yung glans penis pala, it basically covers the tip of the corpora cavernosa. Okay, so in the male, the penis is not only an organ of copulation, it is also where the urethra passes through. So it serves both as organ of copulation and as part of the urinary system in the male. Okay. In the female, of course, the clitoris, which is the embryonic counterpart of the penis, Okay, there is no urethra that passes through there. Okay. The flora of the penis, okay, is basically here. Okay, uh, attaches to the pubic arch, so, okay, covered by this cavernosus muscle. Converge anteriorly, okay, and lie side by side with the dorsal part of the body of the penis, form the corpora cavernosa. So the flora of the penis is basically the root of the corpora cavernosa. So if you take a cross section of the penis, you see that it will be made up of three cylindrical erectile tissue that is sheathed or covered by your back fascia. It is the tubular sheath of deep fascia in the perineum. I mentioned about the uh, perineal membrane, that forms the sheath covering around the testes, around the penis. Okay? Now, in the uncircumcised male, the glass penis is covered by the prepuce or the foreskin. And if you go on the ventral side of the foreskin, you will notice that the glass penis is attached to the foreskin via your perineum of the prepuce. And if you follow it, you follow the penis proximally, okay, to its root, okay, you will find a sensory ligament. Okay. Ito yung cross section penis, and you will see there already, okay, right below or right inside, inferior to this back fascia, okay, it's your deep dorsal vein of the penis, okay, and your artery, and iba po yung superficial dorsal vein, which lies outside the back fascia. Now, the back fascia can actually, accidentally be injured. When the penis is in the erect position, this back fascia can actually be torn. Most of the time during sexual activity, uh, the back fascia can develop a tear and it can have an hematoma. Usually occurring during sexual intercourse, okay, when the penis is in the erect position. Okay. Let's apply to the penis. Okay. One coming from the external pudendal artery, another coming from the internal pudendal artery. Okay. The one coming from the external pudendal artery supplies the deeper part of the penis, while coming from the external pudendal, okay, supplying the skin and superficial fascia of the penis. Okay. Deep artery of the penis supplies the pleura of the corpus callosum, the illicit arteries supplying the spongy erectile tissue of the corpus cavernosum. There is an artery to the bulb of the penis, okay, and the dorsal artery to the penis, which goes to the skin and fascia. Okay. Now, the nerve innervation to the penis is via this all important pudendal nerve. I mentioned about the pudendal nerve being an important innervation to the perineum, provides somatic innervation to the skeletal muscle of the perineum, and the thoracic plexus supplying the autonomic to the smooth muscle, lalo na in the blood vessel. Lymphatic drainage. Okay. For the erectile tissue, it will go towards the internal iliac nodes. But for the skin of the penis itself, okay, it will go to the medial loop of superficial inguinal node. Okay. So yung superficial part of the penis, okay, ang lymphatics nun goes to the inguinal region, while the deep part, lalo yung mga erectile tissue, okay, will go to the iliac, internal iliac node. Now the scrotum, which is an outpouching of the lower part of the abdominal wall when the testes descended to the perineum. So in the early embryonic life, the testis is found inside the body or in the retroperitoneal region, and then it will descend into its perineal position, scrotal position, and as it does so, it will carry with it all of the layers, almost all of the layers of the anterior abdominal wall, forming an outpouching sac. That's why the layer of the scrotum has a counterpart in the layer of the abdominal wall. Okay. Notice this one. This is the dartos fascia, which forms the septum that separates the testis, the left and right testis. And you will have other coverings here. Okay. I mentioned about the layers of the scrotum having corresponding layers in the abdominal wall. Okay. Your subcutaneous fascia will become your dartos, dartos colles. Okay. Your external oblique becomes your external spermatic fascia. Your internal oblique becomes the cremaster muscle. Yung transversus abdominis is the only layer of the abdominal wall that does not have a counterpart in the scrotal sac. Okay? And then after your transversus abdominis, you have the transversalis fascia that becomes the internal spermatic fascia. And the last layer is the peritoneum, is the one that becomes the tunica vaginalis. So the tunica vaginalis, you can imagine, two layers siya that covers the anterior and the lateral part of the testis. Okay, it does not. The testis is not found inside the tunica vaginalis. Actually, it in sheets only. So, tinatakpan lang na yung testis, okay, on the anterior and to the lateral side. That's why you can think of it as a diverticulum. Okay, that's why if the tunica vaginalis remains patent or open, then it will have a connection with the peritoneum above. So if your fluid in the peritoneal cavity can seep down into this open layer of tunica vaginalis, then you can have a clinical condition known as a hydrocele of the scrotum. Okay, right. Now the scrotum itself, okay, is supplied by this blood vessel coming from the femoral, okay, the external pudendal branch of the femoral, okay, and branches coming from the internal pudendal. Now you also have a subcutaneous plexus of arteriovenous anastomosis that promotes heat loss from the scrotal skin. Okay. There are veins, of course, that accompany the arteries. Now, when it comes to innervation, the innervation of the scrotum on the anterior side, anterior half, comes from your ilioinguinal nerve and the genital branch of genitofemoral. But the posterior side will come from the posterior scrotal branches of your pudendal nerve. Okay? So, sa likod, pudendal nerve, sa harap, ilioinguinal and genital branch of genitofemoral. Lymphatic drainage, okay, from the wall of the scrotum, again, superficial inguinal node. Pero the content of the scrotum, which is the testis, okay, will go upward into the para-aortic. Now, this is the male urethra. I think we discussed this already in the male reproductive. Okay. It's about 20 centimeter long, extends from the neck of the bladder to the external urethral meatus. It's divided into three parts: prostatic, membranous. Prostatic is the most dilatable, membranous is the least dilatable, and the penile urethra is pendulous part. Okay, male urethra. Okay. The prostatic urethra is about 3 centimeters long, and that's where you find the opening of the prostate gland. In the membranous urethra, only a short 1.5 centimeter long, and it's found at the level of the external urethral sphincter. And you know that the external urethral sphincter is found in the deep pouch photo. And notice that in the deep pouch, you also find the bulbourethral gland. But I said that the duct of the bulbourethral gland does not empty into the membranous urethra. it empties here into the penile urethra, specifically at the bulb of the penis. Dito po nag-open. Sa blood mo, nandito ka na sa penile urethra. Now, the penile urethra is found in the corpus spongosa at about 15 centimeter long, 15.7 centimeter long. Okay. It is the part where the glans penis dilates. The part where the glans penis, the part of the penile urethra where at about the level of the glans penis dilates and becomes your fossa navicularis, okay, or fossa terminalis. So I think that would be the end of this lecture.